Hello, hi everyone. I'm Rendy Murphy, epidemiologist and director of disease surveillance here at the Mobile County Health Department. Today is Tuesday, August 23rd. We're here just to share a little bit of information about a couple of topics. We've done a lot of Facebook Live around the COVID epidemic and things, or pandemic, and things are quite different now than they have been in the last couple of years. We've been at this, um, you know, 2.5 years. This is our third year of dealing with COVID, so we all would like to not talk about it anymore, including myself. So I just want to mention just a couple of things. COVID cases and hospitalizations are going down, except in the 5 to 17-year-old group. So in that group, we're still seeing COVID transmission increasing. It's no surprise as we have returned to in-person learning with masks optional and cohorting optional and quarantine no longer required, and all of those things that we're happy are in our past. So I just, we're celebrating that, but just also remember right now that our COVID level for this community is still high, which for us means our CDC's recommendation for communities that are in the high category are to stay up to date with your COVID vaccines. So if you have not received at least one COVID booster, please do that. If you're eligible for a second booster, please get it now. If you have symptoms, get tested. Stay at home if you're sick, but get tested for COVID. If you're at high risk of severe complication, if you were to catch COVID-19, talk to your healthcare provider. Consider additional precautions to protect you if you're going, to public spaces or if you're traveling or something of that nature. And right now, when our community level is high, CDC recommendations are still to wear a mask indoors in public. So that's where we are right now, although most of the things that we have talked about in the past with regard to COVID we can leave them in the past. So a big thing that we announced this week, I think yesterday, is that a new COVID vaccine product has been authorized by the FDA, and we have it at our family health locations and also at our location at the Southwest Public Health Center at 5800 N Road. That's in the Tillman's Corner area, and also at the Festival Center, which is at the corner of Montlamar and Airport. So both of those locations have it. You can just walk in, no appointment necessary, but our family health locations have it as well. You can make an appointment to get vaccinated with any of the vaccines, including the new Novavax vaccine, by calling 251-690-8889. But again, this is a 2-dose series administered between 3 and 8 weeks apart, depending on if you have some health conditions that you might want to stretch that duration, that length between the first and second dose. And right now, a booster dose is not authorized. It's just new on the market, so I'm sure we'll be talking about that going forward. It's not a messenger RNA vaccine, so if you were previously worried about that technology and had been holding off on a more traditional protein-based technology vaccine, we have it now, and please, go to one of our locations, our walk-in locations, or call to make an appointment if you have been waiting on that vaccine. Also about COVID, just wanted to talk about, a lot of people have test kits at home. A lot of people are testing at home, and this is a great situation to be in. And we put on the screen up here some guidance on what to do when you test at home. So again, if you test positive, you need to stay at home for 5 days, and then you can go on about your business on day 6 if you have been symptom-free for at least 24 hours, but we would like for you to wear a mask for the duration of 10 days. So again, if you test positive, then stay at home for at least 5 days, and if you're symptom-free on the 6th day, then you can lift isolation, and we'd ask that you wear a mask when you're in the community until day 10. And then if you have symptoms and you test but you're negative, we really want you to test again in a couple of days, because it could be an early false negative test. So if you have symptoms, respiratory symptoms of COVID, and you test negative at home, please stay at home. Test again in a couple of days. If it's positive, then stay at home for at least 5 days until you're feeling better. And if it's negative, then you can consider testing again, but you may want to talk to your provider about maybe seeing if there's something else going on with you if you have persistent respiratory symptoms. So again, if you have symptoms, stay at home for just to protect your family and your friends from any of the respiratory viruses that are circulating, and follow this this very nice guide if you test at home, whether you are positive or negative. All right, some other really good news. We have today this has been something that we have been looking at internally, but we released today publicly our final report on the hepatitis A outbreak that we began seeing in the fall of 2019. So nearly 3 years that we have waited to before we could declare the end of the hepatitis A outbreak that we had experienced. If you could remember, this was an outbreak that was being seen nationally in different areas across the U.S. Sort of late in the game, we started seeing outbreak cases of hepatitis A in Alabama. We had a large vaccine campaign where we were trying to get people immunized who were at highest risk. These were mostly adults, mostly men. A lot of people who got Hep A were hospitalized. There were a total of 219 cases, so very small compared to what we're seeing with COVID, of course, but very significant outbreak nonetheless. And we have gone a couple of months without an outbreak case, so we can declare that outbreak over. We're still emphasizing that if you were born before 1996, then you likely did not get a Hep A vaccine as a child, and you might want to consider getting vaccinated for hepatitis A. So particularly if you are an illicit drug user, if you have been diagnosed with chronic liver disease, if you've traveled extensively outside of the United States, if you're experiencing homelessness, or if you've been in direct contact with someone with hepatitis A, those are definitely reasons to seek hepatitis vaccination. But also, if you did not receive hepatitis A as a child, you might consider it as an adult, and that's for people who were born before 1996, when it was added to the list of childhood immunizations required for school entry. All right, let's see. Want to talk a little bit about monkeypox?
2 questions.
About Hep A?
No.
Okay, we're going to stop for some questions.
Is there a waiting period between the last booster and this new Novavax vaccine?
So the Novavax, what's approved for the Novavax vaccine is a primary series. So a Novavax primary series would be for someone who was not previously immunized for COVID with with Pfizer or with Moderna. So if you've been vaccinated with Pfizer or Moderna, you don't need a Novavax primary series.
How soon can I get the new COVID booster?
So we have just begun seeing some movement on the COVID booster that has the data have been submitted to the FDA, but the FDA has not met to determine if that booster is going to be authorized. There's a lot of talk about it because it's a multivalent booster. It was built against Omicron variants BA4 and BA5. The data have been submitted, but FDA has not met and voted yet as to whether it's going to be authorized or when it will be authorized. So right now, the only booster availability or for anybody over 5 for a single booster, and if you are 50 or older, or if you are any age with immunosuppression or with immunosuppression, then you can get a second booster.
What does the new Novavax cover?
What does it cover?
I guess to Pfizer.
So it has this, similar effectiveness as the Moderna and the Pfizer. So it was built for parent COVID, right? So not built specifically for any subvariant or any variant, but should provide protection against some of the COVID variants that are circulating right now. Almost 90% of circulating strains are Omicron? Okay. Those were some good questions. All right, so we will talk a little bit about monkeypox. I think everyone, if you're watching us, you probably know that we announced the first case of monkeypox in an Alabama resident occurred in a Mobile resident. This was back 3 or 4 weeks ago. We have had additional cases of monkeypox diagnosed in Mobile residents. The state is mulling over how they're going to report this information out. As you know, when numbers are very small, we can't give a lot of details about the cases as to, protect their identity and protect their health information. But we have had additional cases diagnosed in Mobile County residents. So there are a couple of things that we want you to do. So if you have symptoms of monkeypox, cover up and seek testing. There is testing available. Tens of thousands of tests are capable every week based on the LRN network, the Laboratory Response Network, and the private labs that are doing testing. So there is no lack of testing available. We have plenty of testing capacity. It may take a few days for the test result to come back, but please do not wait to get tested if you have symptoms of monkeypox. So malaise, a rash that develops and starts to multiply pretty quickly sometimes, but you could also have just 1 or 2 bumps, and usually these are in the genital or perianal region, but they can also be in the mucosal area, so in your mouth, can be on your shoulder, on your arm. So if you think that you have been exposed to monkeypox and have symptoms of monkeypox, cover up and seek testing, because there are plenty of places that you can get tested, and there is treatment available for those people who may suffer severe illness with monkeypox, or sometimes these bumps or these lesions are really, really painful, and getting treated with an antiviral might make you feel a little bit better. It might be a little bit less painful or a shorter duration of illness. So please, if you have symptoms of monkeypox, cover up and get tested. And then we also want everyone to sign who is a male who's had contact or intimate contact with another male, whether you've had multiple partners, known partners, anonymous partners, if you've been diagnosed with a newly sexually transmitted disease recently in the last 14 days or so, please sign up to get tested. To get vaccinated against monkeypox. Supply is limited, but right now we are able to meet the demand. So please go onto our website or on our app and mchdcares.com and click on the monkeypox link, or you can download our app. I'm going to hold up this shiny. Is it showing, Mark? So you can put your camera right up there on that QR code and download the app, and then you can click this red coronavirus right there, and it will take you to our website, mchdcares.com, and there you can click the link to sign up for monkeypox vaccination. So again, we want people to sign up, particularly if you have had, if you're a man who's had intimate contact with another man, whether or not you think you may have been exposed, right? If you have been in those settings, if you've had multiple partners, if you had anonymous partners, then we want you to sign up to get vaccinated. All right, and I think that is it. All right, Mark's saying no more questions, so we will keep it there today. And again, as usual, if there is any new or urgent information that comes up on any of these infectious diseases, we will come back on and let you know. So stay safe out there, everyone, and be well.